Merci.
Okay. Thank you very much. Merci. Ladies and gentlemen, I thank also the organizers for the opportunity to be here with you. I'm a bit embarrassed because there are so many scientists in this room. I'm not a scientist, I'm an economist by education, with a doctorate in international economic relations. But I worked for about a quarter of a century in the secretariat of the International Narcotics Control Board, which is one of the international drug control bodies. And therefore I was asked by the organizers of this meeting to prepare a presentation to give an answer to the question whether medical use of cannabis and cannabinoids is possible under these international drug control treaties. Well, the present international drug control mechanism is based on 3 international conventions. The first one here indicated is the Single Convention on Narcotic Drugs. It's called single because before 1961 there were several conventions and protocols dealing with the control of narcotics, and they were then united in 1961 in this single convention on narcotic drugs. It was later amended by the protocol in 1972. Then we have the Convention on Psychotropic Substances of 1971, and finally the third one is the United Nations Convention against illicit traffic in narcotic drugs and psychotropic substances of 1988. I would like to emphasize that these conventions have almost universal accession. So almost all states in the world, except for some small islands in the Oceania, have already become parties to these treaties. And therefore it means that our governments have taken on themselves an obligation to implement the provisions of these treaties. So what are the objectives of these international treaties? Well, objective of the treaties. The philosophy of the international drug control treaties is based on the understanding that controlled substances, or most of the controlled substances, have a dual character. The substances can, on the one hand, be very useful in medicine, but on the other hand, these substances may lead to dependency and may cause great harm to individuals and to the society as a whole. So therefore, for most of the controlled substances, the basic principle of the international drug control treaties is to limit the use to medical and scientific purposes, but also, when limiting this use to only these purposes, also to ensure their availability for those purposes. So this is the basic principle of the present international drug control system, the limitation use of controlled substances to only medical and scientific purposes, not to allow recreational use, for example, of drugs. Now, as a point B in this slide, however, for some narcotic drugs and psychotropic substances which are considered very dangerous and which are considered without special therapeutic value, the convention even encourages governments to restrict their medical and scientific use. So let us have a look at how cannabis and cannabis extracts are controlled under the international drug control treaties. Now, cannabis and cannabis extracts are controlled under the 1961 Single Convention. And here, as I indicate in this slide, this convention has 4 schedules of controlled substances and preparations. 4 schedules. Now, in Schedule 1, we can find a total of about 110 narcotic drugs. You would find there such drugs like morphine, you would find there heroin, opium, cocaine, you would find them phenethylline, oxycodone, etc. But you would find there also cannabis, cannabis resin, extracts and tinctures of cannabis. So under the 1961 convention, in the list of narcotic drugs, in the first list of narcotic drugs, you would find also cannabis, cannabis resin, and also extracts and tinctures of cannabis. The convention has then Schedule 2. Schedule 2 contains only 10 narcotics, and those are narcotics like codeine, for example, which are considered less dangerous. So for Schedule 2, the convention prescribes a bit less strict control regime than for substances in Schedule 1. Schedule 3 is a schedule which contains exempted preparations. There are preparations of narcotic drugs which contain a very small quantity of active substances, for example, small quantities of codeine. And under this convention, these preparations are exempted from most of the control measures. But finally, we have also Schedule 4. And Schedule 4 is here in red, so it's kind of warning. And in Schedule 4, we find again a bit of narcotics which are included already in Schedule 1. And for example, we find here cannabis, we find here cannabis resin, we find here heroin, ketobemidone, some fentanyls. So this is Schedule 4 of the convention. So it is interesting, we have cannabis in Schedule 1, and we have cannabis also in Schedule 4, and cannabis extracts we have only in Schedule 1. So what says the convention for substances in Schedule 4? The convention, as the governments adopted it in the 1961, says that in Schedule 4 are substances particularly liable to abuse and to produce ill effects, and the convention says that such liability is not offset by substantial therapeutic advantages which would not be possessed by substances other than drugs in Schedule 4. So this is the definition of substances in Schedule 4. And the convention continues, and the convention says for substances in Schedule 4 that a party shall, if in its opinion the prevailing conditions in its country render it the most appropriate means of protecting the public health and welfare, prohibit the production, trade, possession, or use of any drug in Schedule 4 except for restricted medical and scientific research. So now we see the situation which concerns cannabis according to the treaty, according to the 1961 convention. Cannabis is in Schedule 4, and as you see, governments are invited to consider, if it's necessary, even the prohibition of the use of this substance. However, if we read this from the point of view of possibility of medical use, so we can see that cannabis is included in Schedule 1 and 4 of the 1961 convention. However, a decision to prohibit the use of cannabis is left to the discretion of parties. So it is left to the discretion of parties. And when a government allows the medical use of cannabis, so it is not violating the convention. So the convention does not prevent the medical use of cannabis. It is possible to use cannabis, and you are in line with the 1961 convention. And with respect to the extracts and tinctures of cannabis, well, they are included only in Schedule 1 of the 1961 convention, and a prohibition is not suggested in this treaty at all. So when we look at the extracts and tinctures of cannabis, the 1961 convention has not suggested the prohibition of the use of them. That means that cannabis herb and cannabis extracts can be used for medical and scientific purposes under the same control measures as other narcotic drugs included in Schedule 1. Now you are medical practitioners, you have experience with the use of narcotics like morphine, etc. And you know that they are strictly controlled, but they may be used. In the world, for example, if we look only on opioids controlled under the 1961 convention, I think 14 billions of doses of these controlled opioids are consumed every year. In France, you consume 2 tons of morphine every year and 1 ton of oxycodone. And in the world, for medical purposes, is consumed 50 tons of morphine. So, for example, your country, I think France, is quite an example in the use of opioids for the treatment of pain. So doctors and medical personnel have experience in the use of narcotic drugs. Doesn't mean that if something is a narcotic drugs, that it cannot be used medically. You know it is possible. Now, if we said that cannabis and cannabis extracts may be used, so let's have a look how it is in reality with cannabis extracts. So today we have heard already enough about Sativex, so I will not spend too much time about it. It is definitely the star among the products of medical cannabis. It has a regulatory authorization, so the standard regulatory authorization as a medicine for treatment of spasticity, and it is in fact the only cannabis product or medical cannabis product which has this full standard regulatory authorization, and this is Sativex. Now, I took from the website of GW Pharmaceuticals this last part of this slide, that it is now has been launched in 15 countries and approved in a further 12 countries. Maybe that in reality it's even more, but this is what they have on their website. So you can see in how many countries it is already in use. It is in clinical trials, I think, in a process in the United States, for example, and I suppose it's closing, also approaching the approval there. Problem, high costs. I think you know the situation in France, so this is problem of Sativex. Now, if we look at medical use of cannabis herb, now we speak about cannabis herb. After the 1961 convention was adopted, most countries followed that convention and discontinued the medical use of cannabis. But now, you know that since the 1990s, after the year 2000, gradually more and more states go into the medical use also of herbal cannabis. And it's not easy for the authorities to allow newly again the medical use of cannabis. And they have some dilemmas, and I tried to put them on this slide. Well, the first issue A, people are using herbal cannabis from black market or from personal illegal cultivation for medicinal purposes. This is a fact. And the competent authorities are, I suppose, not very happy with the fact that their citizens are violating the law. But why they are violating a law? Only because they want to get a medicine. So it is not a very nice situation for governments. And sometimes the courts are deciding that, well, that these citizens have actually the right to get their medicine. So even the courts decide that the law in a way is preventing the people from getting their medicine. And in some countries, this was at the origin, at the beginning of really cannabis herb programs, that the courts were deciding that people should get legal access to this cannabis, and because they want to use it for therapeutic purposes. For example, in Canada, where they have a law regarding human rights. So on the basis of this law on human rights, the court decided in the year 2000 that the government has to establish a system which would enable the people in Canada to get access to legal access to medical cannabis. Well, so this is one of the dilemmas in front of governments. The second one, as I already mentioned, herbal cannabis is not a registered medicine in any country. So governments have experience how to regulate registered medicines, but herbal cannabis is simply different. So somewhat they do not know what to do about it. C, is medical cannabis a Trojan horse for legalization of recreational use of cannabis? Well, maybe some governments or some people think yes, you know, they push us first the medical, the next step will be recreational use of cannabis. So this is something, this is the third thing which is in the heads of administrators or politicians when they think about establishing cannabis programs. And finally, they have to decide, well, what to do if we would allow medical cannabis. Should we allow individual cultivation, or should we try to ensure a provision of a medical grade products? So many questions in front of authorities, and so I think you understand it's not difficult, not easy for the governments to go ahead here. And why? Well, I put as the last line, sometimes is a problem even in the administrations itself, because of course, I have worked in administration for a long time, so administrations prefer status quo. Administrations do not very much like to experience. So if somebody wants to establish a medical cannabis program using cannabis herb, then a positive approach is needed. Really that the government may be encouraged by the patients and so on, but takes a kind of positive approach. And when I looked at the websites of authorities of different countries where there are medical cannabis programs, I really liked this statement of intention of the medical cannabis unit in Israel, in the Ministry of Health of Israel. So this is on their official website, and they say, yes, medical cannabis is not registered as medicine. Its efficacy and safety when used for medicinal purposes has not yet been established, but nevertheless, there is evidence that cannabis could help patients suffering from certain medical conditions and alleviate their suffering. And second, the Ministry of Health wishes to remove obstacles to the supply of this drug to patients who could benefit from it medically. So it's a very kind of positive approach that the government took in that country and decided, yes, it's not registered, we do not know everything about it, but anyway we know it helps some people, so we have to remove obstacles and we have to make it available to patients. So let's look at the next slide. The next slide is showing in which countries patients have access to legal herbal cannabis. So have legal access to herbal cannabis. Yes? I tried to put this data together from different information, from press, from literature. So this data may not be exact, and today may be a bit different, but in principle, they reflect the situation. And you can see that legal access to medical cannabis, to cannabis herbs, according to the data for the United States from last year, from October last year, in 19 states and in the District of Columbia, had about 1,137,000 patients. So that was in the United States. In the next column, you can see how many people these are for the 1,000 residents in that 19 states and in the District of Columbia. It's 7.7 patients per 1,000 residents in these 19 states of the United States of America. When I said that they have legal access or access to legal medical cannabis, as you know, in the United States, they are also in this dual situation. It's legal on the state level, but it's still illegal from the point of view of the federal legislation. But under the Obama administration, there has been a kind of decision that they will leave the issue of cannabis for decision to the states in the United States. So the federal legislation still considers cannabis as a totally illegal drug which should not be medically used, but in the states, the state legislation allows for that, So we can say, and the federal government is not intervening anymore, so they have kind of legal access. And because it's state by state, I'm now showing how different it is also among the different, or between the different states in the United States of America. Some of them are very liberal, like Colorado is very liberal. So 21 people have access to, are considered as patients using medical cannabis for 1,000 residents in Colorado. In Washington, D.C., it's much less. The system is much more strict to allow patients to be prescribed or to be authorized to use cannabis medically. So for example, the state of New York, which recently also opened its medical cannabis program, has a quite strict regulations. So there are different regulations state to state in the United States. Then Israel, now it's being said that about 22,000 people have now access or are now authorized, licensed in Israel to receive medical cannabis. You can see that it's like 2.7 person per 1,000 persons in that country. In Canada, last year the number was given at 40,000 people. In the Netherlands, 3,000. It's a country which started in 2003 with the medical cannabis program, but well, I found 3,000 in some literature. I found also less. I found like 1,200 who get medical cannabis from legitimate channels. In 2013, Czech Republic and Italy also established programs for medical cannabis, so it is possible to prescribe medical cannabis in these two countries, but it's starting, and you mentioned some of the obstacles to the use of medical cannabis in these countries. Well, they started with cannabis imported from the Netherlands. In 2013 was, available cannabis from the Netherlands, and it was extremely expensive. So one of the problems, for example, in the Czech Republic, where the insurance companies do not pay for that, was this very high price. The 1 gram was like 11 euro, 12 euro. That was a price which was extremely high for the people in this country, and also in Italy. They had to pay much more than the Czechs for this 1 gram. So also in Italy, I think it's very expensive, especially in those regions of Italy where insurance companies do not pay. I think in Italy it's region by region. In some regions it's paid, in some regions not. So the governments in these two countries want to make it more cheap, and they are starting cultivation in these countries. You know, the Italian army is cultivating cannabis, and I think 100 kilos should come to the market by the end of this year, and they would like to put the price down, maybe up to $5 euros per 1 gram, if possible. And in the Czech Republic also, the first Czech producer of cannabis will be supplying by the end of this year 40 kilos. It's not so much, but again, the price should be relatively very low in comparison to the Dutch cannabis. Should be like 2.5 euro, 4 euro in the pharmacies per 1 gram, so much cheaper than the other one. Then you have mentioned here, I mentioned here countries which import, for example, from the Netherlands, but on the basis of exceptional permissions. So in Germany, you have a few hundred of people who get cannabis also, but it's based on exceptional permission. They have to, go through an administrative procedure to be allowed to buy this imported cannabis. Or even some of them are allowed to cultivate themselves. But there is a movement in the world towards more and more use of herbal cannabis. And for example, I understand Germany is preparing a new legislation to facilitate it. But you have heard definitely that Australia is preparing a new legislation. Chile already produced the first cannabis, I think, to be used for medical purposes. Jamaica is preparing a law to allow for medical cannabis. Uruguay is also planning to allow a medical cannabis. So there is more and more countries going into the medical cannabis. We have here some numbers. How many people are allowed in these countries to use cannabis? when I was preparing it, I found it quite interesting. Let's have a look. You know, is it too many, or is it only a few? If you look at the United States, 7.7. Is it very high because they are very liberal, so everybody can get it easily? Let's have a look how many people are using daily opioids in these countries per 1,000 inhabitants. I'm now not comparing effectiveness of cannabis and opioids, but simply for interest to have a look how many people use these opioids, these controlled narcotics in this country. So daily, my estimate is that in the United States, per 1,000 people, 51 use opioids every day. Or in Canada, 29. I don't know whether I succeed to go back. No. Okay, sorry. So if you look here, for example, in Canada, it's now, with these 40,000 people, is 1.1 per 1,000 residents. The Canadians say in 10 years, they may have 400,000 people on medical cannabis. So it will be like 11 per 1,000 residents. If you look how much opioids they are using, they are already now using 29 people in that country per 1,000 are using daily an opioid. And you know adverse effects of opioids, but it's a kind of comparison only. I think quite interesting when we speak about cannabis. What is also interesting to know, governments have to report to the United Nations, to this International Narcotics Control Board. I had the honor to use to work for. They had to report to the board at the beginning of the year their estimates how much they will require of cannabis for medical purposes and scientific purposes in their country. So here, for example, Canada informed the INCB that they will need this year 55 tons of cannabis. And you see this increase, they needed, 5 years ago, they needed 6.5 tons. Israel reported 10 tons. These two countries have, I think, quite reliable estimates. And then other countries, Italy is already third in this table. The Italian government reported 1 ton, 800 kilos. So whether this will be fully used, I don't know, but that was the estimate. And you can find Germany, you can find France. I would like to say that these requirements for cannabis include also cannabis extract. So if they expect that they will be importing Sativex, because it's extract of cannabis, they have a kind of calculation to say how much cannabis, in fact, they will be importing, if they are importing extract, the quantity which was needed to produce that extract. So this is quite interesting. You can find it on the website of the International Narcotics Control Board, what are the estimates of countries for this cannabis. This International Narcotics Control Board is a body under the International Drug Control Treaties which should monitor how governments are implementing the provisions of these treaties. So sometimes it calls themselves that they are guardians of the international drug control system. They tell governments, yes, you are in line with the treaty, no, you are not in line with the treaty, it is possible under the convention, this what you do is not possible under the convention. So they give this kind of opinions. And in the annual report of this board, which was published in March of this year, it was a report for last year, for the year 2014, and the report is available on the website, and the report is of course available in all languages of the UN, so of course in French. They devoted a special chapter to the medical use of cannabis. These are these paragraphs 218 to 227. So those of you who are interested in these regulatory issues may consult it. And what is interesting, I could only put some points out of it, but they confirmed very clearly that the single convention allows to use cannabis herb, for medical purposes. It's allowed under the convention, it's nothing illegal. But of course, that the governments have to implement the control measures which are prescribed by the treaty. So for example, the countries where cultivation takes place must establish a so-called National Cannabis Agency. And that this agency should have a monopoly on wholesale trade and stocks of cannabis, on wholesale stocks of cannabis. It's not so difficult to establish a cannabis agency. That might be associated with one of the existing bodies, and if it's not too much work, it might be one person. But the treaty says, because the treaty was formed on the experience of opium production in India, you know, in the 1940s, 1950s, so the treaty requires a cannabis agency, and the treaty requires this monopoly. Several countries have experience with control of opium. For example, France is a country which is cultivating large quantities of opium poppy for the manufacture of alkaloids. So countries are able to organize control of cultivation. Now, INCB pronounced itself also on cultivation by individuals and expressed the opinion that cultivation by individuals for personal medical use is not in line with the convention. That simply it cannot be controlled sufficiently. So that was one argument. And the second was that also from medical point of view, to ensure the quality of the medicine in individual cultivation is in general very difficult. So INCB's position is against allowing individual cultivation by patients. And then INCB reminded government that prescription of cannabis should be performed with competent medical knowledge and based on scientific evidence, and also taking into account the fact that there are many side effects with the use of cannabis. Finally, quite important point, INCB again reiterated that WHO should look to medical utility of cannabis as well as to the dangers of cannabis, so make a kind of evaluation of this drug. Because WHO in the United Nations system is the body which provides scientific opinion on drugs, whether they should be controlled, whether they should not be controlled, whether they should be controlled in scale 1 or in scale 3 or in scale 2. So this is the role of WHO. So we may see in the future that perhaps some kind of this evaluation comes from WHO, and governments will have to consider whether cannabis will remain in the same scale of the convention as it is now. Very quickly now to individual cannabinoids. While cannabis extracts are controlled under the 61 Convention on Narcotic Drugs, cannabinoids individual are controlled under the 1971 Convention. You will find several isomers of delta-9-THC in Schedule 1 of that convention, but the most important one, delta-9-THC, is in Schedule 2. In Schedule 2, where is, for example, methylphenidate or amphetamines. So the logic of the 71 Convention is that most strictly controlled are substances in Schedule 1, less strictly Schedule 2, even less strictly Schedule 3, and much less strictly in Schedule 4. Here is a different logic from the 61 Convention. So it goes from 1 to 4, and the strictness of control goes down. So quickly in Schedule 1, parties are invited to prohibit the use except for scientific and very limited medical purposes. Schedule 2, substances can be used for medical and scientific purposes under control measures for that schedule, and that control measures are somewhat slightly less strict than control measures prescribed for narcotic drugs in Schedule 1. So cannabis delta-9-THC, and this is the next slide, delta-9-THC can be used for medical and scientific purposes under the control measures for substances in Schedule 2 of the 71 Convention. So can be used. And very important, only THC is under international control, and other cannabinoids such as cannabidiol, CBD, are not under international control. So if there is a pure kind of CBD, then this is not a narcotic drug. There is no relation to the international drug control treaties in that case. How it is in reality with the medical use of these cannabinoids? Well, we have heard, you know, that there is one drug which has been, again, duly registered, and this is Marinol, and this is based on synthetic dronabinol. And you see it's already in 1985 when it was approved in the United States for the treatment of nausea and vomiting associated with cancer chemotherapy. And in 1992 it was extended also in the United States for the treatment of anorexia associated with weight loss in patients with AIDS. So this is one way how you can get to the delta-9 THC, dronabinol, and the second form of how they are coming to patients is through magistral preparations of dronabinol. And we will hear probably more about it today. And then you can see consumption, according to the government reports, the INCB was of dronabinol in 2013, I think 59 kilos of a substance was consumed in the United States, in Germany 8 kilos, and in Austria 4 kilos. So these are the quantities for tons of other substances, psychotropic substances in Schedule 2 are consumed for medical purposes. Again, like with narcotic drugs, you know, people know how to control these substances. So control should not be, in fact, a major obstacle to the use of these substances. So, for example, methylphenidate is used in quantities of tons for the treatment of attention deficit disorder. You can see dronabinol is used in quantities of kilograms. There is a controversy about the present international control status of cannabis and cannabinoids. There are, of course, many critics of the present control status and would recommend the change. There is example from the history, change is possible. Conventions have a mechanism how to make a change of the status of control, scheduling status of the substances. So in 1991, for example, delta-9 THC was moved from Schedule 1 to Schedule 2 of the 1971 Convention, because of the use of dronabinol in the United States of America, of the Marinol. So it was a clear indication that yes, it has a medical use. Therefore, World Health Organization recommended a move from Schedule 1 to Schedule 2, and the Commission on Narcotic Drugs of the UN, which is the body which votes and decides whether the substance should be under control or not, the body decided to put the delta-9 THC in Schedule 2. In 2014, WHO even decided to recommended to governments to move delta-9 THC from Schedule 2 to Schedule 3, which is less controlled even under the 71 Convention. But as I said, it's a controversial issue. Only few governments in the Commission on Narcotic Drugs, I think 8, voted for this suggestion. The majority was against. The majority was not very much in favor of releasing the control for delta-9 THC, and maybe not so much because of delta-9 THC, but of the kind of signal it could send regarding the use of cannabis. But these requests for review of cannabis by WHO are coming more and more, even from such bodies like INCB. Next month, just in 1 month, WHO Expert Committee on Drug Dependence is meeting in Geneva, and they will hear some kind of preparatory paper on cannabis. So it will not yet be kind of official evaluation, but it might be interesting what kind of conclusions these experts of WHO will have. So if you are interested, I suppose WHO will put the report of its meeting also on its website, and you can have a look at it. So final conclusions. If somebody asks you, is medical use of cannabis and cannabinoids possible under the present international drug control treaties? Yes, it is. I think it is possible. We have many examples of other narcotics, other psychotropics which are used in very large quantities, so it is possible to use it. What is needed, of course, that the national authorities take somewhat proactive approach, because it's not easy, because cannabis is a special drug, a very special plant or special plant material. So this is not so easy for them. And what I think is very important also to emphasize, especially here in Europe, I think that legalization of medical use of cannabis is really not a step towards legalization of recreational use, and that these are two totally different issues which should not be mixed. I think sometimes the people, I'm not very happy if I see that activists which are supporting medical cannabis, the same day on their website support also recreational use of cannabis. I am not so sure what kind of service they do to medical cannabis. I think not a very positive, because it brings, let us say, the impression of governments, again, especially here in Europe, also against the medical use. So I think it's very important to distinguish between these two issues. Thank you very much for your attention.